Yes.
And in today's session, we will talk about healthcare plan. Healthcare plan is quite healthcare insurance and mirror image, but slightly complex than other plans. Example, we need to get healthcare rate, we will create. When you select healthcare plan, again, healthcares are different types based on the flat rate or calculated rate or percentage. Let's go with flat rate, I will show. So here, the new things what you're gonna see here is this coverage details and then the benefit rates and eligibilities, sir. Okay, benefit rates and eligibilities. Okay, so we will discuss in detail. But before that, sir, do you remember we discussed about coverage targets, insurance and healthcare coverage targets,
Yes.
right? So we're going to reuse that one. If you're not, if you didn't remember, I'm happy to configure again. Yeah. But you remember, right? This healthcare.
Yeah. If you want to touch it again, you can quickly just touch it so that I
Yeah,
can have
sure.
complete flow of the steps for healthcare plan too.
Sure, sir, definitely. To create healthcare plan, first thing we need healthcare coverage targets, which means only employee plus spouse, employee plus spouse plus child, employee plus spouse plus child plus parents or family. Okay, these are all called coverage targets. After that, you need to create healthcare rates. Healthcare rates. So if only employee is enrolled, what is the employer-employee contribution? If employee plus spouse is enrolled, what is the employer contribution? Is it a pre-tax or post-tax? Okay, these we will discuss under healthcare rates. Okay, healthcare rates. And we will have different types of rates. Different types of rates in the sense, one is a flat rate, calculated rate, multiply by compensation. Multiply by compensation. In today's session, first we'll focus on flat rate. Okay.
Okay.
And then next I'll pick up calculated rate. So how it calculates is based on your base pay or based on a combination of two compensation elements from compensation. Okay, or it can be a flat rate. So something like that. Okay. So first, we will proceed to create. First, we will proceed to create healthcare coverage targets. Access the task. Healthcare coverage targets. You can say maintain healthcare coverage targets. This one we created, sir, if you remember. These are the relationship types: employee, family, domestic partner. So how many minimum maximum we can enroll? What are the allowed dependent types? What are the required? Whether enrollment is mandatory? Okay, we have given all these details. What is the coverage target overall family? Usage count and inactive. Do you remember this one?
Yes.
Right, sir? Fine. So let's go with the same video. We created AMD for insurance coverage targets similarly. The next one is we will create healthcare targets. Healthcare, not coverage targets, sorry, healthcare rates. Okay, so let me give a scenario so that based on that we'll create. Create new healthcare rates for salaried employees. Create healthcare rates for salaried employees and ensure the cost breakdown as per the table. Table I will tell you. So you can go to your tenant, access the task, create healthcare rate, create healthcare rate. Healthcare rate is nothing but it will allow you to view the existing one, whatever the values are flat rate, percentage of salary. These are calculated, sir. Whatever the one you already created, it will allow you to see the rates. You can reuse the rates as well for any other plan, something like this.
Okay.
Okay. So let's create our own healthcare rate for our session. I'm also looking into my document. Create healthcare rate. Effective, I'm going to give 112023. We will give healthcare rate is AMD. What name we will give? Salaried healthcare rate. Method of rate calculation, I'm selecting flat. We will also talk about percentage of salary as well. First, I'll
Okay.
select flat amount. Okay. Demographic factors. So flat amount, would you like to differentiate the flat amount based on the years, employee age, or based on the length of the service in months, or based on the salary, or none of the above? So what does it mean is the healthcare rate will be different based on the employee age, sir. The employee age keep increasing, the rate will be keep increasing. Okay, the rate will be keep increasing. Sometimes what happen based on the length of service, the employee healthcare rate may be increased based on the years of service of the employee, or the healthcare rate can be based on the salary. So what I'm trying to say here is, let me give some examples. Practically, we will talk about. For example, I have an option to give the rates. If I talk about age, if I talk about age in years, let's say employee who's ever age between 20 to 30, they may have the healthcare rate is $50. Employee, if the employee health is 35 to, okay, let's say 40 to
No,
50,
from 31 to look
31.
at the
Yeah,
bracket. Okay.
yeah, something like that. Correct. I'm just selecting some random numbers.
Okay, random. Okay.
31 to 40,
To 40.
then $60. So here the amounts will be different based on the age. Correct, sir? Similarly, years of service means if the employee completed 12 months or 24 months or 36 months, the amount will be different. We will talk about all these. First, I want to go with basic one.
Yeah.
Then based on the salary, if an employee salary is between $5,000 to $10,000 base pay, this is the amount. Or 10,000 one US dollars to 15,000 US dollars, this is the amount. We have such requirements, we may choose this salary. Okay. Now let's go with a basic, as I said, none of the above.
None
None.
of that. Yeah.
So we'll talk about each and all because as I said, health and insurance is massive subject.
Okay.
Now tobacco use. So this is a flag. Why it is required is if any employee is consuming tobacco, then the healthcare rate might be slight change for this person. Okay, it's a kind of a flag. Okay, so effective date I entered. Healthcare rate I have given. For now, I selected flat amount, not percentage of salary, not percent of salary with flat amount. I just a flat amount I have chosen, and then none of the above. Okay, so we will land here. So you can enter the description. It is optional. You can enter description like who are all you would like to assign this plan, something like that. You can give it here. So then rate. So what is the frequency? This amount, the rate, healthcare rates deducted on what frequency? According to the customer requirement, yearly or hourly or manually, sorry, monthly. You can select. Some choosing monthly is always by default.
Okay.
Then based on the country you are implementing, sir, you can select this currency. Okay, you can select this currency. Okay. Okay. Now here you have coverage targets. These ones. What is this? These are called healthcare coverage targets. This one, sir. These
Yeah.
targets we are calling into healthcare rates. Okay. Yeah. So let's say employee plus spouse, employee only, employee plus children. Okay, we'll select these three. Right. Or sometimes employee plus child or employee plus child is good. Employee only, employees plus spouse plus children, employee plus spouse. Okay, if you see sir here, we don't have an option called employee plus children. Okay, employee plus children is not there. Let's create one for that. So we are going to get one healthcare coverage target. We can access the task maintain healthcare coverage targets. I will add one row. Let me show the order is one. What we'll do? Employee plus children. Minimum count 1, maximum allowed is 2. We'll add the row children or son or daughter, or you can select child. Oh, our values are here. Okay. Save this. The same field should come here. Refresh. So we'll select employee plus children, employee only, employee plus spouse plus children. Let's call it as a family, or you can select this, or you can choose this.
Family. Okay.
Okay. Spouse, employee plus spouse. Okay. Okay. We have employee plus child is there. Then we have employee plus spouse. We have then after employee plus family, we have then employee plus employee only is also here. Okay.
Yeah.
Okay, then scroll down, select okay. Once you select okay, the next page you have rate bands. Okay, select this rate bands. Now here enter the rate bands according to the requirement. Okay, what first we'll go with employee plus child. So healthcare, right? It is a pre-tax. Okay. So let's say if employee plus child is enrolling, we will give flat amount $135. Employee plus child, $135. Then employee plus domestic partner, I mean spouse, we
For
will give it
spouse.
as $145 over here. $145. Then after employee,
Okay, anyway, we are just doing practice. Usually, employee plus spouse will be cheaper than plus children.
oh, is it?
Yeah.
Sorry, I put other way around.
We are
Okay.
just doing random. Yeah, it's okay. Let's go ahead. Let's put that at one, let's say 125.
One,
Employee plus spouse, 125.
sure. 125. And then who else?
Or employee only,
Only
maybe 95.
$95. Okay. Then after employee plus family,
Yeah,
whole
yeah,
family.
you didn't put, you put in subcharge. Okay. Mhm.
Yeah. Employee plus family,
That's 145.
145.
They're just using hypothetical figures anyway.
Okay. So this year our right side, we have post-tax, pre-tax. Make sure
Yeah,
we have to enter in the right one. These are the employee amounts. Okay.
yeah.
So employer cost also we can give here, non-taxable. So any random amount you want to tell, sir? Or shall I give something random?
Yeah, random, yeah.
Employees plus 7, 265. Sorry.
No, you are changing. Mhm.
They should be very careful. 265. Actually, I'm seeing, looking into my notes and entering the data here, the values.
Okay. Mhm.
Employee plus family, how much we will give? Plus 320 will give. Multiplied. 320. Then employee plus house, 225 will give. Then employee only, we will give 120. Okay. So
Yeah,
this you're clear, right, sir? Post-tax.
very clear. Yeah.
Okay, fantastic. Now, we do have benefit surcharge, some additional charges for the benefit provider. If you would like to, I mean, surcharge is pretty straightforward and creating. For now, what I do is I will select existing surcharges, and tomorrow we will pick up the credits and surcharges as well.
Okay.
So, employee plus family, employees plus spouse, we will see. If employee enrolling employee plus family, some surcharge additionally they would like to pay. What are GMS spouse surcharge, something. Okay. So we'll give $30. This is not required. Here only amount will be there. Okay. So credits and this one again I will explain in detail these fields. So we have created our healthcare rate bands. Any questions are here?
The benefit surcharge, is it compulsory or it's optional? If
It's
the
optional.
requirement, if they don't have a surcharge, it will be left empty, right?
Yes, sir. If they don't have surcharge, we can left empty, but we can create if surcharge is applicable from the provider. You can select create surcharge here, enter the date. What is the surcharge type based on tobacco surcharge or spousal surcharge, and you can give the surcharge name here. Some
Okay.
additional cost since they're enrolling into the spouse. Some $20-$30 extra. Okay.
Yeah. But I think most of the time, anyway, the surcharge I've always seen it are more like for tobacco users that they
Yeah,
get extra charge.
exactly.
Yeah.
Exactly. Not sure why they don't include alcohol. They will include only tobacco. Surcharge. Okay. Then after currency, annual. annual surcharge, flat rate amount of $30. Should be additionally per annum
Okay.
employees pay. Okay. Right, sir? Is it clear on rate bands? So here you can see
Yes.
healthcare targets. Here you can see rates. While creating healthcare targets, if you identify any type of target is not available, directly you can access this task called maintain healthcare targets.
Maintain that.
You can create them. Yeah. Okay. With this, we'll create our plan. No, coverage. So again, we need to start from scratch. Maintain benefit coverage types. What will give here? We will give BRT medical.
Yeah.
Okay, I'll go with your name. Okay, I'll go with the AMD, sir. Later, while you do practice, you can give BRT so that it's easy to figure it out.
Okay, perfect.
AMD medical classification. Let's select your visionary icon. Which one you want, sir? Heart.
It's okay.
Sir, classification, did we discuss in the last session? Well, we're talking about basics. Okay, anyhow.
Yeah.
Okay, I will still pick up. So these are quite common, you are aware. There's no big difference for this, but I will select it as only additional thing is medicals and flex credits can be applied or not. So credits, surcharge, again, I'll pick up in tomorrow session. Okay, so I'm saving this record. Let's go ahead, create benefit plan. Effective date. Provider, we will select MetLife if it is exist. Okay, wait. Then plan type, healthcare, flat rate,
Great, yeah.
or you have options also calculated one. Select OK. Coverage target type we selected AMD medical. Classifications you can enter HMO. Benefit plan. So if you don't give the plan name, so you know, right, it will pick up MetLife AMD medical or
Okay.
MetLife AMD medical. I will remove this one coverage type. Let me do okay. If I remove it will be
Then under that classification, we can, if we have the HMO, if we also have you can take two or more, or only one can be
only one.
selected.
Right, sir. What happens here is when you select three over their healthcare coverage types, you can create three different types of medical plans for HMO, PPO, VSP with the same coverage type.
Okay, so we'll create them as different plans.
Yeah, we are going to create, sir. This is flat rate, right? Now again we need to
Yeah.
get percentage. We need to get based on the years, etc. Three plans will create.
Okay.
So plan name I'm not giving. Let's pick up from the coverage type and the provider.
Okay.
So participating group, this one customers will provide GPR number, group policy number.
Yeah, policy and all that. Yeah.
Yes, sir. Then
Salary.
active employees in say
Yeah.
additional. Oh yeah, dependent eligibility we need to create. So we have mentioned here spouse, children, and Right, sir. So we need to create dependent eligibility rule also. Okay. Let's create that. So create benefit eligibility rule. Dependent benefit eligibility rule. Let's name it as spouse, child. Again, when I say child, son or daughter. So here select relationship types.
The spelling relationship is wrong. Okay.
Yeah.
Okay. Then
Child,
child, okay.
spouse. We will also select. Did I select spouse only, right? Yeah, this will decide. If not, it's not working, we'll troubleshoot. Yeah. So anyone, child or spouse are visible. That's what we're saying. Copy the text, paste it here. Overage dependent eligibility. So you remember, right, sir? If the child is 21 years and above, 24 years and above, child should not be eligible for this plan and no longer eligible, right?
Okay.
I think the
Okay.
same concept in US also, right? 21 or 24. Yeah. We can create. We will discuss during our passive event rules. Remove the plan from the children whose age reaches to the 21. Okay. Request provider ID. If you select this checkbox, it will ask you to enter provider ID at the time of enrolling into the plan. Okay. Auto enroll means automatically the plan will be enrolled. When you choose this option, please do remember you don't have an option to waive off the plan,
Select.
right? Automatically it will be assigned. It's a highly deductible health plan. This is just a flag for the payroll team. So this plan is highly deductible. Okay, it's a reporting purpose. Derive coverage targets, which means we already gave the coverage targets based on the derive. You can select this option. Okay. Then let's also require this. Oh,
Oh, you have to check.
no, someone refreshed it. Let me see. Our data is still there. We didn't lose the data. USD. Okay. Use individual rates because we are not making externally, hence it needs.
We need to uncheck requires provider ID since we don't have the provider ID.
Okay, we can do that. Yeah. Then we'll select this on monthly basis. Right. Earnings and deduction mapping we will do later. So this ones are I said ACA, Affordable Care Act. I have not worked much on this option, but however, I will provide the notes. Funding method, minimum essential coverage. Okay, I will give the details. Now go with explain plan details. You can give the description if required. And here, additionally, you have display order for coverage details, sir. Okay, coverage details. You have a display order. It's purely optional. The same details you can directly maintain on the. Okay, let me do this. I will show the comparison. So, sir, kindly hold these three. Okay, I will walk through tomorrow because healthcare we're going to talk about 3-4 sessions.
Okay.
So, benefits, rates, and healthcare. The benefit group we already selected plan. The same one will be available here. Active employee salaried. And this is the employee domestic partner member. Everything will be defaulted based on this. So please remove the values whichever you think are not applicable. But how come it should be default the values? Why it is not default? You got my point, sir? What I'm saying?
But is this our home? I thought this is
Whole total session thing. Healthcare. What mistake I have did here? Mhm. So what I'm saying here is it should bring the values which we are given healthcare rates.
okay.
Mm-hmm. Okay, me cancel this. I just change the calculator rate because it should ask us to enter healthcare rate. Here we go. Sorry, sir. There's a correction. I choose in the flat rate. That's the reason it doesn't give. It is asking you to enter. When I switch to the calculated rate, so automatically what are the logic we already given the healthcare rate. Here I have an option to select like this one. Okay, the one we created.
Okay.
So one correction from my side. I supposed to select calculated rate. I selected flat rate. That's the reason we didn't see that one. You clear, sir, what you're talking?
But I'm still looking, even with that, when for that of the healthcare flat rate rather, it didn't pull the rate we created before, which
Correct.
means that we can still enter our own rate.
Right, right. Let me tell you. When you go with the flat rate, right, it doesn't bring the healthcare rate which we created. It
Yeah,
doesn't bring this one. You need to enter the values directly on the plan level. Option one.
yeah.
So we have chosen, let's default the rates from the healthcare rate. Okay. If you go
Okay,
with that option, I must switch to calculation, not the flat one. So it's my bad. I selected flat one. Did I confuse you, or you got the point? Okay, okay. I will tell you, sir. There are two things, sir. Okay, while you're creating plan, flat rate. Another one is calculated rate. If you choose flat rate, all the healthcare coverage targets will be defaulted, and you need to enter values for each coverage, each target, healthcare target. If you go with calculated rate, okay, the healthcare rate you created will be defaulted. So I selected spouse, employee plus spouse, employee plus children, employee plus family. These are all right. All these will be defaulted. If you go with this option, everything, what are the coverage targets we have created, everything will be defaulted. Of course, though it is defaulted, you have an option to remove those targets. Okay.
Can we do something? Can you do the tax create healthcare rates? I want to see something there.
Oh, yeah. Okay. So we'll do one thing. I will create this, then I will create
Okay.
another one with different.
Okay.
Since we are
Okay.
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 Classification, PPO. So rest we already discussed. Active employee, salaried USA. Okay. Dependent plan eligibility also we created. AMD, dependent spouse, child, daughter. Require ID you mentioned not required. Derive coverage targets. Scroll down. This I said we will talk. So here, select the benefit group. Target, I'm gonna select AMD. Okay. So
Okay.
here I have my healthcare rate and healthcare target rates.
Yeah.
Okay. Right, let me try to save this. This is ready. Now I'm going to create another benefit plan, sir, as I mentioned. Yeah.
No, it's rate that I want to see. I want to check something under the rate.
Okay, you want me to edit the rate which we created?
Just do create our healthcare rate. Yeah.
Here are the rate bands.
No, when we go to the method for rate calculation,
Method for rate calculation.
we chose
Okay.
flat
That will
method.
come. Gotcha. I got it. That
So
will come only if you create a brand new healthcare rate. Yeah.
yeah, that's what I'm trying to see. I want to see what the behavior is when we do a brand new healthcare rate, and we chose that to be calculated instead of flat.
Oh, that time we selected flat, sir, but let's calculate it. Yeah. Healthcare rate name. Which one will select?
Okay, calculate rates. Okay.
Flat amount, percentage of salary with flat amount.
Okay, so now, okay, this was where we chose flat amount.
Exactly. I understood, sir. So the confusion here is, here we're choosing the flat amount, okay?
Yeah,
But creating the plan, we selected calculated.
yeah.
That's a confusing thing, I agree. But that's how they gave the plan type. Right.
Okay.
Shall we test our plan and then we'll create?
Let's just go ahead. Yeah.
Yeah. Then we'll talk about percentage, then talk about this, and then also we'll cover this as well. Yeah.
Okay.
Okay, rest of the setup is quite standard, sir. Let's create benefit event, AMD healthcare plan. Okay, we'll get enrollment event rule. Add the row. Benefit coverage type. Medical, and this is applicable now since it is a healthcare. Allowed benefit plan changes. Can select any plan. Allowed dependent changes. Can add dependents. Additional dependents are allowed. What dependent types are allowed? Child, spouse. Anything we are missing here? Defaulting rules. Right. So what is the last step we need to perform, sir?
The last one after that will now be push.
Okay. Plan year definition.
Plan year definition. Pre-plan year definition.
Okay, sir. We'll proceed for testing. Whom we will select? Who I will select? Exactly.
Let's okay. Our favorite. Let's
Exactly.
reject it. Yeah.
Sir, before that, allow me to cancel the open enrollment test today we initiated, na?
Yes.
Or else it will messy. Yeah. Will cancel or not? Okay, let's cancel. Okay, so we're good to go. Mr. Jekyll. Actions. Benefits. Change benefits. Okay.
Yeah.
Submit. Open. Enroll. Select. Employee only, sir. Employee only. This is employee contribution, employer contribution. Yeah.
Most of the time, the employer contribution field, it will be hidden.
Oh, hidden. Okay. Yeah,
Yeah.
we can do that. If you would like, then we can hide it. Yeah. Okay.
No, when I'm through my practice, I would. Okay.
Take care of that. Okay. Okay. Adding dependent. Hmm. Okay.
Was
What
unable to
then?
grab a
Oh,
coverage target.
coverage is employee only. I am enrolling dependent. System was unable to derive a coverage type. Please contact your benefit administrator. Mm-hmm.
No, because we selected for employee only, so it's not supposed to. We are not supposed to have for a dependent because it's for $95, which is for employee only.
Okay, but our plan also, we're allowing to enroll spouse, child, and other people also, correct? Family. No, I got this one. The coverage is currently applicable only for employee. Definitely true.
Okay.
It's correct. But I also would like to enroll the spouse. But when I select, I'm getting this error. The first, if it is only employee, 100% is correct. No issues. We can still proceed. But why, while selecting spouse, is giving error? Need to troubleshoot. Acha. Okay. I expected this. So you got my point, sir. What went wrong?
It says requires to enroll, but was not checked.
Hmm. Let's fix it. So wherever we can see spouse, we have to see the reference ID. Yeah. 620 point. 620.3. Which one here we gave? Okay, now we'll give it a try. I'm canceling this event. Okay. Intro. Select. See the difference, sir?
Okay. Okay.
Okay. Now, earlier in before page employee only. If only employee want to enroll, you can save it. Now I selected dependent. Okay. Now it's
Yeah.
not giving error. So I will tell you why we had an error also. Here, relationship we are saying spouse, correct, sir, worker level. But in the healthcare coverage targets, what I did is I selected randomly, not the right value. So
Yeah.
what we're looking into employee dependent relation plus your eligibility relation plus healthcare rate relation. All three are in should be in sync. Then only it will be applicable. Okay. We'll save it. Very good. Review and sign in. I accept. Statement we will see. Worker profile also will go and see. Looks like it's still in progress. Let me check. This Cobra. This BP is killing us. Who is with this step now? It doesn't have Cobra. How come Cobra is triggering? So I'm just removing the Cobra step, sir. Okay. Now we shouldn't go for Cobra eligibility. So again, I'm going to repeat. Okay. Oh man, how it is. There is an issue with the BP, sir, not with our configuration. It is working, but BP is annoying. Hmm. Okay. Actually, I bypassed the other one, but I will remove the step. For now, we'll check the config. Right, sir? Spouse plus dependents, employee cost, employer cost. Any questions, sir, on this?
No.